first thing a parent has to do is to reach out and ask for help, make the first phone call and say, I want to schedule an assessment. But during the assessment, the student, the mom, the dad, and a counselor sits down and we talk with mom and dad first, and we collaborate and find out what's going on. What are you seeing at home? What is school saying? What is the community saying? But what are you seeing at night when they come home? And we collaborate, and then mom and dad have a seat. They fill out some paperwork. It's a questionnaire. And then we talk alone with the teen. During that time, we're asking about age of onset. When did this child begin using? What's going on in their life? Is there a dual diagnosis? Maybe there's some depression going on. Maybe grandma or grandpa died 3 years ago and they have a need to talk about that. Maybe they're experimenting with drugs and alcohol. Maybe they've just tried it a few times. So we look at the big picture, and after that assessment is over with that teenager, mom and dad come back in the room, and that's a time where we discuss, what does this student need? What does this family need? Do they need education? Sort of like when you take your son or daughter to the emergency room. The doctor will assess, well, do they need a Band-Aid? Do they need stitches? Or do they need surgery? What is it that this child needs? Sometimes they do need to come into an inpatient level of care, but more than often we'll find kids who are experimenting, and then they go to what we call a prevention program, which is simply an educational program. We also would do a urine drug screen to make sure that if the child says, no, I've never done cocaine or heroin or some of the fears mom and dad have a baseline urine drug screen so they know exactly what to look for in the future.